I'm Dr. Langlais from Hasbramo Hospital, and I just wanted to talk about why a lot of veterinarians recommend early detection testing. It's also referred to as wellness testing, and we do it primarily for three reasons. So number one is to establish a baseline, and what that means is what's normal for your pet when it's healthy. So if it's ever sick, we can compare. Let me illustrate with a little diagram. I'm going to talk about a test called creatinine. And creatinine is a kidney test that veterinarians will commonly run to screen for kidney disease. And for a lot of labs, the reference range is 50 to 200. And the numbers really don't matter, but it just illustrates a good example. So let's say I have two patients, and I run blood work on them when they're young and healthy. And they both have two very different creatinines. One of them's 60 and one of them's 180. They're both healthy, right? And it's both normal. And let's say one of those animals comes back a few years later, now it's middle age and it's sick, and as a veterinarian I'm trying to find out what's going on, I'm going to probably recommend to run blood work. So let's say a patient comes in and now its creatinine is 190. Well, if I've never done blood work on that patient before, I'm going to say it's less than 200, it's normal. And for patient B it is. 180 or 190 is not a huge difference. But look at patient A. That is triple what patient A is normally sitting at, and that patient has early kidney disease, and I would miss that diagnosis. So that's the number one reason that we recommend early detection testing. The other reason is we want to catch things early while they're still easy to treat. So let's again talk about creatinine. If I have a patient whose creatinine is, let's say, 270, it's now in advanced kidney failure, it presents to me, it's not eating, it's not drinking, it's been losing weight, maybe there's been a history in the past of drinking excessively. You know what, by the time the kidney tests are elevated, 3/4 of the kidneys are gone. So we know it shows up on urine tests when about 2/3 of the kidneys are diseased, and when 3/4 of the kidneys are gone, we have a test that high. You know what, at that point it's almost too late, and the prognosis for that patient is severely guarded. But let's say for that same patient, I picked up a test and it's just slightly out of range, or it's at the high normal of range, and I'll talk about trending in a minute. The prognosis for that pet is excellent. I've picked it up before there's clinical signs, before the animal is sick. It's just an accidental diagnosis. So for the animal, that's wonderful. For the pet owner, it's good because the treatment is a lot less expensive. And for the veterinarian, it's good because we don't like to have to put animals down, and we don't like to have depressing diseases to treat. We'd much rather be proactive and pick things up really early in the game. So when I talk about trending, so when a pet comes in every year, and I can do a physical exam, and there's things I can pick up on a physical, but there's things I can't pick up. I can't pick up if a pet has diabetes or early kidney disease or early liver disease, but it will show up in many cases on blood work. Same with overactive thyroids in cats. And so let's say I've been following patient A, and all through its life its creatinine is normally sitting at 60, and now it's starting to climb. Well, you know what, I'm not even going to wait till it's above 200. I'm going to intervene here when it's just in the high end of normal, and it may be as easy as just switching the diet to a diet that's more appropriate for that stage of the animal's lifestyle based on what the blood work's showing. That's going to cost the pet owner minimal. We're going to be able to extend this animal's duration of life and quality of life for a long, long time. It's a whole different ball of wax. And a good analogy is when you and I go for our checkups and doctors are checking, our sugar in our urine, they're screening for that, they're screening our cholesterols and our HDLs and our LDLs. I mean, I'd rather find out that I have a high cholesterol than have a massive heart attack and then, oh yeah, you've got heart disease. So that's sort of what wellness testing is all about.